Hi, this is Emily Matthews. I'm a realtor serving the Tri-County area of Calumet, Manitowoc, and Sheboygan counties, here with Annie Wallander of Kiel and Holstein Family Dentist. So nice to meet you. Thank you for agreeing
as well
to the interview.
Yeah.
And you're a dentist. So what was it like when you first started?
So dentistry has changed significantly in the 15 years that I've been doing this. I graduated from dental school in Boston.
Wow.
I'm from Appleton, but I went to dental school in Boston.
Okay.
I moved to the Chilton area after I finished my dental school.
Okay.
And I worked there for about 8 years, and then I worked in Fond du Lac for 2, and then I moved up to this, or I started coming back to this area,
Right.
and have been working here in this office. We were on Fremont Street for 2 years, and we've been in this office
Right.
for 1. So,
Well, and they were on Wisconsin.
yes,
In
yep.
New Holstein.
So,
That's good.
yeah.
And I always like that you have like up-to-date stuff. People think, oh, you have to go to a big city for this
Yes.
up-to-date, dentistry, but you don't.
Yes, yeah.
You
So
know.
when I started, we were doing a lot of impressions where we're using a lot of like that goopy material to do things like crowns or dentures, pretty much anything that needed to go to the lab, we did that. And since we've been here, we are not 100% digital, but we are, I would say we're about 85% digital, which means that we're taking digital x-rays, so we're decreasing the amount of radiation about 80% versus the traditional. We're taking digital scans, so instead of the goopy impressions for the vast majority of patients, we are doing scans that we're sending to the labs. We're able to do same-day crowns where you come in. If you need a crown, we can do all the work and do all the lab work in the office, so instead of having to come back in 2 weeks, Dr. Furtick does implants, which is a big change in the last couple of years too. So he can do tooth replacements here in the office, so we don't always
What did you used to have to do that?
So we did. Dr. Furtick is doing a lot more now because we have more time. So instead of sending you to the surgeon, we can do things much more digitally, and he can do more in the office because there's more time, and we have a little bit more technology, which is really nice.
Okay, I get it. Yeah. What would you say is something most people don't know about what you do?
What I think the vast majority of people have some idea, but I think one thing that people might not know about the office is we're trying to see a little bit more kids and be more family friendly. Instead of having people having to go to Sheboygan or Manitowoc to have their kids seen, we are more than willing to see kids, which I think some people don't think the local offices are. They think it's a little bit more adults, and maybe they have to go to the pediatric office.
No, you don't.
Right. No,
My daughter brings her kids here.
Wonderful. That's great. That's services.
It's certainly nice to only drive 10 minutes instead of 35 minutes or something. So, yeah. So what are your favorite places to go to around here? I know you moved around a lot.
Sure. Yep. So I lived in New Holstein for 10 years, and then I've lived here in Kiel for about 1.5 years. We just built a house. We really like to go. New Holstein has fabulous parks. I have little kids.
Yes.
They're 6 and 8, so everything I do is skewed towards little kids. But we love going to the parks and the pool in New Holstein. We are actually, the office just ordered from the Little City Pizza up the street, and that was really nice. It was something different, I help out at the school with the PTP, so I'm always at the elementary school doing that sort of thing and helping out with a lot of that stuff. So
wow.
Yes.
Do you do anything besides doing this stuff with your kids?
Yeah. So I like to do. My mother likes to do crochet. I like to do cross stitch and embroidery. Which I don't have a lot of time to do, but I do really like to do that. Yeah. And I like to bake a lot. I've really started like baking bread, and so that's something that's new that I've kind of tried to do. And in the last couple of years, I've gotten into canning, which my husband thinks is a little bit too much work because it's a lot that goes into it. But I never did it before, and one day I was like, I'm just going to try it. So I went and I bought all the stuff, and I got apples, and I started canning applesauce and apple fruit pie filling and all sorts of stuff. So I keep busy doing some of that stuff.
Yeah, I know it's a lot of work, but I always can, and I make our spaghetti sauce, and it's so much better than the store. It's only one part of the year, and then
Yes.
the rest of the time you just open it up.
You got it. Yeah.
Kind of nice.
Right? Well, especially too, like with groceries, it's like you go to the store and some of it's just like, whew, that's a little bit more. Maybe it's worth the investment to really figure this out.
That's why my daughter does it too.
Yeah.
She's like, I save a lot of money.
Right? Oh, for sure. Yeah.
Well, anyway, thank you so much for your time.
Yeah, thank you.
This is Emily Matthews here to help you with all your real estate needs. And that's it for now. This is Emily Matthews here to help you with all your real estate needs. Don't forget to subscribe. It's the little icon with my head on it. Have a wonderful day.